All right, so in this video, I'm going to give an overview of how to assess ribs in a very general way. And you can actually make a lot of progress with your clients through this general assessment and treatment format. So there are two diagonals that we're going to assess the ribs on, okay? So the first diagonal is going to be here, right? If we think about breathing, in general, with ribs, you're going to have more motion on the front overall than you're going to have on the back where they attach into the spine. It should move everywhere, right? But more so, the ribs are going to move up and forward with inhalation, and they're going to move relatively down and back with exhalation. Okay, so this is called more so the breathing diagonal. Whereas if we're up at the shoulder and we're on this diagonal, typically, whenever you rotate, let's say I'm going to rotate to the right, or Kelsey's going to rotate to the right, the ribs that are closest to me are going to move down and forward. And whenever she moves or rotates to the left, they're going to move relatively up and back. So now with this diagonal, we're talking more about a functional dysfunction. So functional as in with movement or rotation. So we have respiratory dysfunction. We're going to use the pelvis as our anchor. And functional dysfunction, we're going to use the scapula as our anchor. Okay? So in order to use the pelvis for our anchor, we want the hips to be at about a 70 to 90 degree angle, which they are. And then I'm going to take the pelvis down into posterior depression, so down and back. And then I am going to use a broad contact on the lower ribs to spring up, the middle ribs to spring up, and then the upper ribs to spring up. And I just want to feel generally, do I get a hard infill there? Okay, and that is assessing inhalation generally. Now, if I take her pelvis into anterior elevation, then I'm going to spring test into a relative shortening here. Lower ribs, middle ribs, that's a little tighter, and then upper ribs. Okay, so right now I'm most interested in middle ribs into exhalation. Now, if I go onto the other diagonal, into more of the functional diagonal, in order to test right rotation, okay, I need to lock the scapular out into the same diagonal I just talked about, which is posterior elevation. Now I'm going to start all the way up high, and I'm going to spring test inferiorly there, spring test middle, spring test lower, okay? Now I'm actually going to say my current hardest infill is into right rotation, those middle ribs, all right? And then lastly, if I want to check left rotation generally, is I'm going to take her scapula, I'm going to take it into anterior depression. Now I'm going to come along here and I'm going to go upper ribs, spring test up, mid ribs, spring test up, lower ribs, spring test up. And there's a little bit of a hard infill on the lower ribs spring testing up. But I'm most interested in the middle ribs going into right rotation or spring testing down and forward. Okay, so I'm here. And now just an example of how I would treat this. I'm locking the scapula out into posterior elevation, and then I'm bringing the ribs into that barrier, down and forward. Now go ahead and breathe there, Kelsey. Good, and out, and relax everything as you breathe out. Good, and in. Good, and out. Awesome. I could also have her bring her head or her hand on her opposite ear and go ahead and raise up there. Good. And now breathe in. Good. And as you breathe out, lower your head down. Nice. So now I'm getting a distraction above while I'm mobilizing down and forward. And breathe in. Good. And out. And drop down as you breathe out. Good, and relax down. So you could do just breath, even though you're working on that functional pattern. You can add in the upper extremity basking seal. I could have also added in an assisting basking seal. So if she comes here and I get on that motion, go ahead and breathe in and raise up as you breathe in. Good, and then out, drop down just a little bit to engage that barrier, and then raise up when you breathe in. And now she's assisting me, helping those ribs go down and forward. Okay, so just giving some different options for treatment there. So you assess all 4 diagonals, determine if it's more respiratory dysfunction likely or more functional dysfunction with rotation, and then treat the one with the hardest infill, and then you would go back and reassess all 4 and continue to treat out any hard infills that you find till ultimately you have a more, hopefully, efficient rib cage from a breathing standpoint, but also from a rotation standpoint.